Hi, I'm Dr. Suman Singh, Senior Obstetrician and Gynecologist at Birthright Ring Hospital, Manakatta Road. Talking about ultrasound in pregnancy. There are a lot of myths and a lot of fears and apprehensions with regard to ultrasound in pregnancy. So many people are worried whether it is safe. So just to tell you that ultrasound uses sound waves. You and I talking sound waves, the same sound waves are used in the ultrasound scans, and these are absolutely safe. There is no radiation whatsoever to the mother or the fetus. So ultrasound in pregnancy is absolutely doable and no problem. Now, how many scans do we do in pregnancy? By and large, there are 5 scans that are done during the course of a pregnancy to understand if the pregnancy is growing well and if the fetus is alright. So the first scanning typically happens between the 7th to the 8th week. It is called the dating scan or the viability scan. This is to ensure that the heartbeat has come in for the baby and the baby is growing well, to reduce any complications like threatened abortion and abortion diagnosis. It is important that we do the scan. The second scanning happens at the 12th week of the pregnancy. It is called the NT scanning or the nuchal translucency scan. Now here we look for a fold of skin at the back of the neck, and based on that and certain findings of the fetus like the nasal bone and other features, we are able to predict whether the baby is prone for certain chromosomal defects. Also, typically at this time, we screen the uterine arteries to see if a lady is prone for getting high blood pressure in pregnancy. The third scanning happens by around the 18th to the 20th week. This is called the anomaly scanning. So this is a complete scanning of the baby head to toe to study the baby in detail to identify if there are any anomalies or defects in the baby. Why is it important to do it at this time? Because if supposing for somebody, unfortunately, if we make a diagnosis of a problem which is life-threatening, then we can offer termination. For a pregnancy in India, termination after 20 weeks is illegal. So we need to finish our diagnosis much well in time. The fourth scanning typically happens between the 28th to the 32nd week, and this is called the interval growth scan to track the growth of the baby and to make sure that the baby is growing well, the fluid around the baby is okay, and also to evaluate structures in the kidney to see if there are any problems in that. The last scan typically happens in the 9th month. Here we evaluate the baby weight, we see the position of the placenta, we see the fluid around the baby, and then the position of the baby is confirmed, and this is how it helps us in planning the delivery. So typically these are the 5 scans that we do in a normal pregnancy. Of course, if a pregnancy is high risk, there may be a few additional scans which may be required in order to make sure that the pregnancy is growing well and it is not getting compromised. So not to be worried, scans are safe and you can safely do it, and you can also ensure and feel comfortable after doing the scans that your baby is being well monitored.